Although, some women just know, I'm done. I don't want any more kids. I don't want to deal with an IUD. I just want to be done.
Yeah, and sterilization or like a permanent procedure so that you can't get someone pregnant or become pregnant yourself is very popular in the United States. For men, they get a vasectomy, and so they just cut that vas deferens or tie it off so that sperm can't travel into the penis. And you know, they can still have sex, they can still enjoy sex, you know, and all that kind of stuff. And for women, then they can get a tubal ligation or get their tubes tied, as people call it, you know, and that would be where they just cut or clip off the fallopian tube so that eggs can't pass through.
Aren't some of those reversible though?
They're not, people are supposed to understand them as being permanent procedures. There are doctors who say they do reversals, but they're so not guaranteed that it'll work, that you'll be able to get pregnant afterward, that doctors really encourage people to think of this as a permanent method, you know, so.
It's really expensive too to try and have
because a lot of insurances will cover vasectomies and tubal ligations, but they're not going to cover a reversal because it's not meant to be reversed. So, and the other nice thing too is like tubal ligations have in the past been, you know, a surgical procedure for women, but that E-sure that they have now is really...
It's the little coils,
right, exactly. Yeah. It's like a coil, a wire coil that they kind of insert where the fallopian tube meets the uterus.
Yeah.
Yeah, like right in here.
That's pretty awesome too.
And so it just like scars over, and so it creates like a blockage so the tubes just can't get through. And that's a in-clinic procedure, you know, same day kind of thing. So that's nice too.
What if, I don't know, you know, sometimes you just get caught up in the moment, you just want to do it, you didn't think about going to the doctor, you didn't think about any of those things. What are some things that we can talk about where, you know, you can buy them yourself, you don't actually have to see a doctor?
Condoms are a great method for last minute.
Yeah, condoms are really good.
When using a male condom, you always want to make sure you check the package first, make sure there's the air bubble in there so you know that there's no damage to the condom and make sure that it's a fresh condom.
Yeah, and that's really important because I've heard a lot of people say that their grandma used to work at a pharmacy or at a grocery store and used to poke holes in the condoms and then put them back in the box because they thought it would be funny, so.
That's not so cool.
No,
or
it's
like if you've had it in your purse and your keys are jingling around in there or whatever, you never know.
And you never want to put, you always want to make sure you don't put the condoms in your wallet because the heat from your body can or your pocket can cause the condom to break down. Then you also want to make sure that you check the expiration date on the back of the condom so that you know that it's a fresh condom.
Right, because just like old nasty milk, you don't want to use an old nasty condom.
Exactly. Then you want to carefully open the package by tearing it.
Not with your teeth.
Exactly, because then you can poke a hole in it, which would be bad.
That defeats the purpose.
Then you want to roll down the condom a little bit so that you can pinch the tip so that there's space for the semen to be when you ejaculate. And then you want to put it on the head of the penis and slowly roll it down the shaft of the penis. And then when you're inserting the condom, when you're inserting the penis, you want to hold the base of the condom so that way it doesn't slip off. And you also want, when you're pulling out after you ejaculate, you want to hold the base of the condom so that way you don't spill any semen on your partner.
Right. It's also really important to use lube when you're using condoms. That can make pleasure better, but it's really important to know you should only use water-based and not oil-based, and then not to use anything with spermicide or nonoxynol 9 in it.
Exactly.
Right, so no Vaseline.
Nope.
No cooking spray.
No.
No baby oil.
Exactly.
Yeah. Water-based.